We're all being told to forget about low-fat diets because, in fact, the key to being healthy is to eat more fat.
Yes, the National Obesity Forum has caused controversy with this new report this morning. It says the way to reduce obesity is to tell people to avoid foods labelled low-fat or low cholesterol and instead eat more high-fat foods like full-fat yogurt, cream and milk. It also tells us to limit carbohydrates like sugary cereals and even bread.
Well, we're joined now by one of the report's authors, Dr. Aseem Malhotra from the National Obesity Forum, and our health editor, of course, Dr. Hilary Jones. Welcome to you both. Right, you want to look me in the eye and tell me that the answer to this ever-fattening torso is to eat more fat?
Well, you know, Piers, I actually follow my own advice, and I've looked at this evidence for a while. I used to be the guy that followed conventional wisdom, sugared cereal in the morning, orange juice, snacking mid-morning because I was really hungry, pasta and panini for lunch, another snack in the afternoon despite doing lots of exercise. And actually, having looked at the data over a number of years, it's very clear that actually when you eat whole nutritious foods that are high in fat, which includes full-fat dairy, eggs, fish, olive oil, nuts, and you reduce the sugar and the refined carbohydrates, which are linked to increasing glucose and insulin, which is actually the risk factor behind many diseases, actually your body corrects itself. And I followed that advice, and I did it for health purposes. And actually, without meaning to, I actually lost about a stone in weight around my belly.
Look, unfortunately, we're in trim with
but
this.
One case study does not make good evidence for broad clinical advice, does it, Dr. Hilary? Because you take issue with these recommendations.
Well, I think there's a wealth of evidence to support what Aseem is saying. In fact, for some time now, we've been looking at the evidence that came from 30 years ago, which was erroneous in saying that all fat is bad and that we should cut down on fat because it's energy dense. If we look at those two breakfasts there, on this breakfast here with the orange juice and the tea with low-fat milk, you've got Weetabix there, brown cereal, and you've got wholemeal bread with marmalade.
I would have that quite a lot.
And that's just carbohydrate. There's a lot of sugar in there.
So that's bad for you?
That's nothing's bad for you if you eat it in moderation, but that is likely to make you feel hungry mid-morning because you're going to get an insulin rush, you're going to get, then you get hunger pangs mid-morning. On the other hand, if you had an omelette, which is very filling because it's high protein, it's cooked with butter.
But what do you have in the omelette?
Well, in that omelette, you've got cheese and you've got tomato and onion and some butter.
Better than the other one.
That's going to fill you up for longer and it's going to be healthier.
But can I, so Dr. Hilary, let's put these points to Dr. Malhotra. Public Health England say that your report is irresponsible. Diabetes UK say there's no consistent evidence for what you're recommending. The Royal College of Physicians say not everybody would agree with these findings. The Association of UK Dietitians says we are not in agreement with you. British Heart Foundation, this report is full of ideas and opinion. However, it needs robust and comprehensive review of evidence that would mean that they would take it seriously. That's a huge number of well-respected organisations who are lining up to attack exactly what you're trying to say this morning.
Susanna, I'm not surprised by this. I mean, at the heart of this report is actually how the establishment have misled us based upon flawed science and perpetuated by commercial influence. I mean, I was one of the first people in the UK to even highlight the issue around sugar when I wrote an article in the BMJ in early 2013. I had the same attacks coming out then. And now the consensus of opinion has shifted because we focus wrongly on demonizing fat. So I can understand their response, but actually I would argue the current dietary advice, especially for people with type 2 diabetes, where they're told to eat lots of starchy carbohydrates, which until the 1970s, this was a condition of carbohydrate intolerance. So the actual advice to treat type 2 diabetics before drugs came on the market was reduce carbohydrates. And actually what your report did earlier, which is excellent, it showed that there's a GP up north called David Unwin who has actually ignored the conventional wisdom, knows the science quite well, has told his type 2 diabetic patients and people at risk to reduce their carbs and sugar and refined carbs and eat freely, including full-fat foods, reverse type 2 diabetes in many of his patients, reduce the need for medications, no adverse effect on cholesterol.
Okay.
This is the evidence. So I think these organisations need to look at it carefully. We have reviewed substantial evidence, peer-reviewed, high-quality papers.
Hilary, I've been hearing for quite a while. I drink semi-skimmed milk just because it sounds like it must be less fattening. But people keep saying, well, actually, you should be drinking full-fat milk. It's better for you. Same with butters and margarines, all that kind of thing. That actually, it's a complete misnomer to be going for these low-fat things. What is your view?
My view is that you can't single out meals and foods into that's all fat, that's all carbohydrate, that's all protein. Because what we eat in reality is a bit of everything.
What milk do you drink?
I drink semi-skimmed because
Why?
because over the course of the day I will be enjoying some fat, but I don't want too much fat.
Okay, Dr. Malhotra, what do you
And that's
drink?
what it's all about. Too much.
I go for whole fat milk, full
Because?
fat cheese. Well, it makes me feel full. The fatty acids in some of the studies we've quoted, and this has come from Cambridge Medical Research Council studies, show that full fat dairy is likely to protect against type 2 diabetes and heart disease. And that evidence is actually very good quality studies.
Yeah.
See, light mayonnaise is on the list of what they say is bad, right? No, but that's bad, is it?
I don't touch it. I advise my patients the same. I said, go for the whole foods. And listen, when you look at actually the best dietary pattern for health overall, I call it a high-fat Mediterranean-style diet. That means lots of veg, olive oil, nuts, oily fish, eggs, some meat, non-processed food. It's actually a very healthy diet.
Piers, when you see a food that's labelled light or low fat, ask yourself what's replaced the fat.
Right.
And what's replaced the fat is largely carbohydrate and sugar. And that's what causes so
I
much
am
of the
marching
obesity
to my
problem
supermarket
today.
immediately after this show, and I am loading up with full fat gear.
Yeah.
I was
Moderation,
waiting for this moment for 10
moderation
years.
in everything.
I know
My
what
wife
you
can
are.
stick her kale where the sun don't shine. Full fat, here we come. Gentlemen, thank you very much indeed.
I know what your trolley's full of. It's just red wine. And red wine and more red wine.
On with red wine. Look at Gerard Depardieu. There's a man happy with life. 87 stone, 18 barrels of wine a day, loads of cheese. Couldn't be happier.
Not recommended by either of the doctors sitting on this sofa.